We started talking about the three main functional areas of the cerebral cortex, and these functional areas are broken down into smaller areas. But we like to think of them in three parts because one part, let me do it this way. One part of the cerebral cortex is responsible for controlling our muscle movements, our conscious muscle movements. So if I want to lift my arm up like this, my primary motor cortex is initiating all of those movements. If I want to smile, my primary motor cortex is initiating and controlling those muscle movements. If I want to get up from my chair, the control of those muscles initiates in the primary motor cortex. Damage to any part of the primary motor cortex creates paralysis, or it paralyzes the muscles controlled by that area. And I'll go back. We've mapped the primary motor cortex, and whatever area of the primary motor cortex that happens to be damaged then becomes paralyzed in the body. This part of the primary motor cortex on every human is responsible for controlling the lips and the muscles that control the movements of the lower lip. This area right here controls the muscles of the upper lip, that part of our face, and so on. And we have a large area of our cerebral cortex that's responsible for controlling the muscles of our face. And if you think about that, compared to the area of cerebral cortex that's responsible for controlling muscles in your arm, which is much smaller, it would make sense because there's a lot more small muscles that have intricate movements that would be required to move the muscles of the face than we would be required to move the muscles of the forearm or the upper arm or the shoulder or the trunk. So these maps look kind of funky. You have this big face represented on this area of the cerebral cortex, while you have a small area of cerebral cortex responsible for controlling muscles of the arm. The brain is created in a way to control more of these muscles in a bigger area because they're more important and they require lots more fine muscle movements in order to control them. Just think about, in order to smile, there are so many different muscles that have to be stimulated in a particular way in order to smile. And in fact, smiling is a very difficult act if you're a very young child. And it's only after we're able to see other people smile that we're able to try to figure out. We have very particular neurons in another area of our cerebral cortex that are able to mirror things that we see in the world and then tell these cells how to control the muscles in the body. Now, the primary motor cortex is right here in the cerebral cortex. It's right in the center of the brain, right about right here, underneath our skull. And it goes left and right hemisphere. This is just a comparison of one side to the other. Imagine this entire primary motor cortex also going on the right hemisphere too. So it's not just on one side of the brain. One side of our brain controls one side of our body. The other side of the brain controls the other side of the body. Right behind the primary motor cortex, we have what we call the primary somatosensory cortex. Or the primary sensory cortex. Sometimes we call it somatosensory. Here, let's just call it one thing, the primary sensory cortex. This is the part of the cerebral cortex that is conscious of sensations in our body. So it's conscious awareness of sensations. Very simple sensations like touch, like hot, cold, how much pressure is being applied at that point, and then pain. And the primary sensory cortex is right behind the primary motor cortex. So that if there's damage to any of these neurons, you no longer have feeling on those parts of the brain. Excuse me, those parts of the body. Let me show you. So right behind the primary motor cortex is the primary sensory cortex. Right here, if you were to have damage to this area, you wouldn't be able to feel anything in your thumb. And of course, it gets down more to detail. And if you have damage to just a small part, you may just be numb on one area of your thumb. If you have damage here, let's say you had a stroke or a head injury, you would have no more sensation on your lips or your teeth, gums, jaw down here, your tongue. Look at how much area is associated with the tongue, just the tongue. There's so much sensation that we need with our tongue and our mouth that the brain has mapped a large area to process all those sensations, compared to our inside abdominal cavity, which has just a little bit of sensory apparatus. So we have, as our three functional areas, we have the primary motor cortex, responsible for movement, controlling movements of the muscles. We have the primary sensory cortex, which senses touch, heat, pressure, pain. But then the third area is known as the association areas. And there's lots of different association areas. And the association areas associate with other primary cortexes. And these are not all of the primary cortexes here. These are just an example of two really important ones. But these association areas connect different parts of the cortex. And they're involved in recognizing things like smells, tastes. They process information coming from the primary cortexes, whether it's the motor cortex, the sensory cortex, the visual cortex, the auditory cortex, and they process that information in order to create things like sound, turn it into music, taste from stimulation on tongue. Check. So this is a picture of somebody who has facial paralysis. This person had a stroke, and that stroke damaged an area of his cerebral cortex. Probably had some type of damage right here to the primary motor cortex, probably right somewhere here in the brain. And because that part is damaged, he's lost the ability to move it. Now, it doesn't necessarily mean because it's paralyzed that it's also going to be numb. It could be, if the damage continued all the way back into the primary sensory cortex. But if it was just damaging the motor cortex, he wouldn't be able to move those muscles anymore. And it would cause the muscles just to droop. And so we see this in people that have had strokes, because those strokes usually damage some area of the brain, and that damage, unfortunately, if it happens to happen in the primary motor cortex, will cause muscular paralysis. So he won't be able to move that side of his face. And that would be permanent. So let's talk a little bit about these association areas. So we have somatic sensory association areas. The somatic sensory association areas process information that's sensed from our body. So information coming into the primary somatosensory cortex, or the primary sensory cortex. It processes, it's right next to it, it's right here. It processes information coming in about body senses, touch, pressure, heat, pain, and it turns it into some type of perception that we recognize. The visual association area, which happens to be right here, is right next to another primary cortex, which we're not going to take notes on, called the primary visual cortex. Primary visual cortex does the same thing that the motor cortex does and the somatosensory cortex does. It just has to do with things that we see through our eyes, visual stimulus. It allows us to process what we see into something that we recognize as like a face or a body or a circle or a square. It takes visual stimulus that goes right in the eyes to the very back of the brain, and then it turns it into something we recognize. Same thing happens for things that we hear. There's the auditory association area, which happens to be right here. It processes from the primary auditory cortex, which again is another cortex we're not going to talk about or take notes on in this class. Primary auditory cortex is attached to our ears, and it hears sounds, and it turns those sounds into things that we understand, things that we can recognize. I guess you could say the primary auditory cortex perceives noise, whereas the auditory association area turns that into sound, something that we would recognize. And then the premotor cortex, which is up here. It's actually a quite large area of the cerebral cortex. It's right next to the primary motor cortex, or the primary motor area, and it processes muscle control. So it would be the area of our cerebral cortex that learns how to do a task over and over again. A task like typing requires a lot of movements of our skeletal muscles and our fingers, repetitive movements. Playing a musical instrument would require this processing of all of these muscle movements that the primary motor cortex is responsible for controlling. Or playing in a sport, dancing. The premotor cortex right here processes that information. It remembers patterns in order to control these muscles that are controlled by the primary motor cortex. And these other association areas do very similar things. We're only going to take notes on the premotor cortex because I think it gives you an idea of what's happening at these other association areas. They just happen to be association areas for sound, association areas for vision, association areas for sense. There are other areas in the brain that take the processing a step further. We're not going to be taking notes on all of those in this class. That would be more of like a neuroanatomy class, or even like a psychology class would talk more about some of these other processing areas of the cerebral cortex that are responsible for taking things we hear, turning them into sounds, and then understanding what those sounds are. Taking information that we hear, processing it, and then sending messages to other areas like the premotor cortex, to the motor cortex, to create words out of our mouth that are recognizable as language. Other areas like the gustatory cortex, which is right here, takes stimulation from the somatic sensory association area and turns it into food tastes, turns it into some sort of experience when we eat food. And so if we look at these different areas, we also notice that we've left out a huge area of the brain, the cerebral cortex brain. And there's some very important things happening in this area. I think I'm on the next level. Getting myself a little bit lost here. Let's talk a little bit about these processing centers. Because if you were to look at certain areas of the brain at any given point, let's say you put somebody's head in a scanning machine and you wanted to see what parts of the cerebral cortex were active while that person was reading something. So it would have to be a processing of language, looking at words on a piece of paper, understanding their meaning. Well, you would see a particular area of the brain becoming very active. And we refer to those areas as processing centers. One very important processing center is known as the general interpretive area. This allows interpretation of what is seen or heard. The general interpretive area happens to be right here. Let me see if I can draw. Happens to be right around here. And what's actually happening in the general interpretive area is the cerebral cortex is processing, like a computer processes, this idea of what is seen or what is heard. Let me give you an example. The general interpretive area is really good at listening, understanding, and then acting on commands like sit here. So let's say you walk into a room and there's a chair in front of you. It's first day of class, and I point to that chair and I say, sit here. Right? You've probably experienced something like that before where a teacher is telling you, sit here. Your general interpretive area is doing a lot of work in order to figure out what to do next. It's taking in information from the primary auditory cortex, directly from your ears. It hears my words as sounds or as tones. The auditory association area processes those tones into sound. You then have an area right here which is responsible for language understanding. We call the Wernicke area, which you don't have to take notes on that. You're taking those sounds that are coming out of my mouth through your ears, and you're processing that according to language that you've learned before. You're then taking that information and you're using what you have seen before as chairs remembered as chairs, you're gauging that in your visual association area against what you're seeing because your eyes are absorbing this image of chair, and you're referencing it against the command that I give you in order to know what you're supposed to do and where you're supposed to do it. The general interpretive area then sends information to the premotor cortex, which then moves your skeletal muscles through the primary motor area to then go over to and then sit in the chair. It's a very complex act that's controlled by your premotor cortex and the primary motor cortex. And so you can imagine at any given moment, there's a lot of communication between different areas of the brain, different functional areas of the brain, different association areas of the brain, and different cortexes of the brain. And it's happening all in a split second. And we'll talk about how it can happen so fast in just a moment. There's also a really important area right here, which we're going to talk about. We're not going to talk about all of the different areas. I'm just going to give you two major areas, general processing center areas. It's known as the prefrontal cortex. So this part of the brain is known as the frontal lobe. The very front of that frontal lobe, so this part here, is known as the prefrontal cortex. And it is the most complicated processing center of the whole entire cerebral cortex. So you can think of the prefrontal cortex right there, probably. Actually, it goes a little bit higher up. There we go. And our most complex thinking and learning happens in the prefrontal cortex. So think about processes like abstract thinking, thinking about good versus evil, thinking about right versus wrong, thinking about terms like freedom. These are abstract ideas. In order to process that information, you need a highly developed, highly complex brain structure for it. And this is what our prefrontal cortex does for us. And I'm not going to go into all the different areas that it connects to because honestly, I don't know how you would process a complex idea like that. But we do know the activity for these type of abstract ideas, judgment, and reasoning take place in this area here. We know that if you put somebody's head in a scanner, a functional MRI scanner we call them, and we do that to see what parts of the brain are active when you're doing certain things or thinking about certain things. When somebody is thinking about justice, this part of the brain is highly active. And of course, it's taking information from other areas of the brain in order to process that information here into something that we make real. Most of our intellect resides in the prefrontal cortex. Complex learning, and it's not on the list here, but decision making, long-term goal planning, all happens in the prefrontal cortex here. This is why the front of your brain is actually the most important to us. And I would even say the most fragile of all of the cerebral cortex, because it's this part of the brain, if for some reason it gets damaged, the human parts of you are housed in there. And we've learned that over the years by making a lot of mistakes. And I'll explain to you one major mistake that has led to a lot about what we know of the prefrontal cortex. There's also speech centers. The speech centers are the speech centers of the brain are on the temporal lobes here. This is where we process and understand language. There's a lot of interaction here with the general interpretive area in our speech centers. And of course, speech requires hearing, it requires language. You can possibly even say it requires some sort of sensory input too. And so you have cells of the cerebral cortex that connect to other areas that are far distantly located from them. And they're able to connect through the white matter of the brain. And so when you want the primary motor cortex to communicate with the speech centers, let's say you're trying to speak, this is a very large distance to travel all through the gray matter of the cerebral cortex. So what actually happens is the message will travel from one area of the cerebral cortex, the gray matter of the brain, through white matter into that gray matter cerebral cortex area it needs to go to. So you have this intricate weaving of connections through the white matter of our brain. And remember, white matter, we're looking at a sliced brain here. The cerebral cortex on the top has been sliced off. Same that you can see here. This is human brain. Part of that cerebral cortex has been removed. And if you remove some of that gray matter cerebral cortex, you'll see that there's all this white matter underneath it. And this white matter, if you remember from our notes, is all myelinated axons. Very fast moving signals can travel through myelinated axons. So if you need communication between one area over here and an area over here, you'll go through white matter, or that impulse will go through white matter. And so let's talk just a little bit about cerebral white matter. The cerebral white matter, its function is to provide communication between cerebral areas and between the cerebrum and the rest of the brain. So once a message starts in the primary motor cortex, it goes through white matter to get to the spine. So you have a fast-moving signal down to those muscles. Or if it's going to go through a cranial nerve down like behind our head, we have the cranial nerves coming out of the front of the brain. It's going to go through white matter. It's also how cerebral cortex areas connect with each other. Message that starts in the primary sensory area or cortex will then maybe travel to the primary motor cortex via white matter. So it gets a really fast moving signal. And I'd like you guys to please write summary number 2 right at the end of this note. So you're going to draw a line across your entire paper. And you're going to write summary number 2 on the left-hand side so that you'll put all of your information on the right-hand side. Though at least three sentences. Before we finish the notes, I want to show you guys an image of something that may be a little bit disturbing to some, but it just shows how much that we have learned over the years about the brain and about brain function. And I think it tells us something too about the fact that, doctors don't know everything, and we learn by doing, and sometimes that doing can cause damage to people and to their lives. And so we always have to be aware of that. So let me get rid of this. Let's do this. So this is an image of a Dr. Walter Friedman. He developed a procedure back in the early 1900s. And this procedure was used to treat patients who had severe mental illness. So you could think of somebody who had bipolar disorder. I don't even know if they had that name back then for it. They called them sometimes manic depressives, people who had severe schizophrenia. And what's happening, and you can't probably see it all that well in this image on your computer, but he actually has a metal stake going into that person's nose. And he's a hammer right here. Yes, Kim, a lobotomy. And what that doctor is doing, basically taking a metal stake, obviously I'm not going to do it to myself, I don't want to lobotomize myself, but he's basically taking a metal stake, he puts it into the person's nose, he slides it past his sinuses. Once you pass the sinuses, you can actually break into the brain, right from the nose, just a little tissue blocking. He hits it with a hammer to break a little bit of that membrane to get into the brain, puts this thing far all the way to the back of the skull, through the nose, and then he takes this metal rod and he waves it from the left and to the right, to the left, to the right, until there's no more resistance. Now, what is he doing? Well, he's doing that, and by the way, this isn't a painful procedure, but the most painful part of it is just getting the spike into the nose, and then once it pushes past the sinuses, there's no pain receptors in the brain. So the person undergoing this procedure was awake, and that's why people are holding his hands while these other doctors are watching. Now, why would somebody do that? Well, let's go back to the brain here, and let's look at what would happen if you drove a metal stake from the sinuses all the way to the back. Well, what you're basically doing is, I think it's easier if I do this, you're taking that metal stake and you are severing all of the white matter connections between the frontal lobe and the rest of the brain. Remember, we talked about the prefrontal cortex. It's responsible for reasoning, abstract thinking, problem solving, right? Well, if this part of the brain is not connected with the rest of the brain and the spinal cord, it basically can't communicate anymore, and it doesn't work. You're severing its functionality. He would basically go left, right, so there would be no connection between the frontal lobe and the rest of the brain. So we call it a frontal lobotomy or a prefrontal lobotomy. He'd make sure he didn't go too far back, and he'd make sure he'd have just the right angle so that he didn't damage any of these other areas back here. Why were they doing this? Well, at the time, it was the psychiatrist thinking that severe depression was caused by some type of mistaken thinking. So they thought that if they severed the prefrontal cortex from the rest of the brain, that individual would no longer care about good versus evil anymore, wouldn't care about solving complex problems, and they would feel better. They wouldn't be depressed anymore. They wouldn't have the weight of life to worry about. And it worked. It actually worked really good. And so a lot of people were lobotomized. And they did this for years. In fact, they still do it in very, very severe cases. They don't use spikes, metal spikes anymore. They do it through electrical pads. You can do it electrically by giving somebody just a really big electrical shock just in the right spot. But it works. It actually cuts off the executive management parts of the brain from the rest. And that person doesn't feel depressed anymore. That person doesn't feel anxious ever again. That person doesn't really care about good versus evil anymore, and they're no longer depressed. But they're no longer really human anymore. They no longer care about doing anything anymore. They no longer care about putting clothes on anymore. They no longer care about taking showers anymore. They no longer care about doing anything in their life anymore. For some, it's so bad that they don't even care enough to eat. They won't eat unless somebody puts food in front of them. And they can. They won't talk unless individuals specifically engage them. They've just lost their will, basically, their reason for doing anything. And so this is really hardly never done anymore. It's only in the most severest of severe cases. And again, they don't do it the same way. But the reason I like to bring this up at this point is just to, explain the importance of this part of our brain. This part of our brain is our newest part of our brain, evolutionarily speaking. And it could be argued is responsible for our creativity. It's responsible for our ability to solve these complex problems, like how do you get everybody living in the same area, creating society and civilization. What really makes us human? And by severing that section from the brain, from the rest of the brain, you still have a living person that can still do things, but they just don't care to do them anymore. So it takes a huge part of what makes us human and just disconnects it from it. Now, this specific procedure was stopped after about 15, 20, 30 years of them doing it. So a lot of people were lobotomized, and they had to be taken care of for the rest of their life in a hospital. But, these doctors were not trying to do evil on these individuals. These doctors actually, look at how all of them were all interested in this procedure. They thought they were helping. They thought this was the way to help these people lead a normal life. And it just turns out that, they didn't know enough. They didn't understand what they were really doing at the time. And it had some very severe consequences. And so we learned. That's what science is about.